Hi Mission, I'm Norie Gonzalez Garza and I'm the mayor here at the City of Mission, and I'd like to welcome you to another episode of Behind the Mission podcast. Joining us here today is Chief Medical Officer Daniel Gutierrez, Dr. Daniel Gutierrez with Tropical Texas Behavioral, and also joining us is Councilwoman Jessica Ortega.
Hello, good afternoon. Hi. Thank you, Dr. Gutierrez, for being here today. This is our second part of our mental health series, and it's so important because this month is Mental Health Awareness Month. And we are here to educate, encourage, and support our listeners who may be needing some help. So my first question is, during Mental Health Awareness Month, what are your recommendations or advice that you have to our community members that are seeking help for maybe a family member or themselves that are going through something right now?
Well, first of all, thank you for the invitation. Thank you for the opportunity to speak to your public here in Mission. And I would say that during this month of mental health awareness, which is the month of May, we highlight this, but in our work we actually do that every day of the year. And the main focus is what we're doing now is awareness, right? I was telling the Mayor Gonzalez that about 50% of the population that has significant mental health needs does not get it. So that's quite a bit of people that need it, that don't get it for a lot of reasons, that have barriers to either awareness of not knowing enough about it, about stigma that is very common, cultural beliefs, a lot of reasons why people will not seek out help. So one of the things that we want to do during this month is highlight awareness that there is significant help out there, but you have to be aware where it is and who can give it to you. So that's important.
And so what advice would you give to someone that feels hopelessness and alone right now? What are the steps? Because you see, as a family, the stigma that you were saying, some of us in the family unit, oh, he'll get better. It's okay, he's just going through a phase. I work at a school district where a child is not doing well in school, and then they go for that psychological, and they find out, okay, they have a learning disability, they have ADHD, and the parents don't go through giving them the medication so they can be better. So we have a lot of community members that might be going through something. What would be the first step for them to get help?
So you're right. I think, the previous Surgeon General of the United States, Dr. Murthy, wrote an incredible essay on the current state of loneliness in our country. It's something that is prevalent all over the place, and there's a lot of factors that contribute to that, but that isolation, that sense of being all alone contributes to people having more mental health problems because certainly our connectivity with other people, through relationships, through seeking help, is something that is the first step in feeling that I'm going better. I mean, we all know that we go to the doctor, we're not feeling good because we have, an infection or something, and we step in, the doctor talks to us, touches us, tells us, I'm going to give you this. And we walk out of the office without any treatment yet, we're already feeling better. So just that first step in knowing that there's something there and going there is a first step in doing that. So
I think that people that go through also depression and anxiety for themselves to also accept that, to take the meds. Because if you see an individual that is suffering from diabetes, they have to do the insulin shots and all of that. Right now, the biggest trend is the GLP-1, the injections to lose weight, because, all of us we get to an age where we want to be healthy. And so that's okay to take. But as far as mental health, it's the same thing. We have a chemical imbalance going on in our brains, and so we need the medications to be able to do good and be well and be healthy. And I feel that going back to the stigma, a lot of people tend to say, I'll be okay. It's going to be okay. I don't need the medication. I don't feel anything anyway. I'm okay. So I know at Texas Tropical, you all do a great job with communicating with your clients and teaching them the reason why they need the medication.
Yes. So, I would say for many of the severe mental illness, like major depression, bipolar disorder, schizophrenia. This is the main group that we treat with adults. In kids, I'm a child psychiatrist. We treat kids with not only those problems, which are not as common in the youth, usually start in their 20s and above, but we see a lot of depression and anxiety disorders in kids, and we're seeing a lot of post-traumatic stress disorder, which is a significant problem for a lot of reasons in our community. I was talking to the mayor about, starting with the pandemic and how many of our family members died and got sick, and we worried that we might not make it through that. So all that produces an incredible amount of stress that went on forever, it seemed like, and it predisposed. And then the families could not go out and seek help because they were afraid of getting contaminated. So there's a lot of things that block or barriers that doesn't sometimes let us. But once we get there and we start receiving treatment, I think a lot of people change their mind about maybe prejudice that they had about it and say, I'm actually doing better. And now that I'm either in counseling or counseling plus medicines or medicines alone, or, if a person is in a crisis, sometimes a brief hospitalization can get them through that. And those severe thoughts about self-harm or ending their life because they're hopeless, you can get over that hump, right? And so then go back to ongoing treatment as a prevention. So yes, all of those factors are very important, And nowadays, last night I was watching TV and I heard for the first time, I've been thinking about it, about AI mental health care. So it's not something that's coming, it's already here. And I was thinking, wow, that can maybe improve access, but hopefully it won't dissuade the public to start saying, well, that's a very easy access and I could get it that way. But, I was telling our clinicians today about that care is an important factor in that definition, because care is better done by humans. Because we can care and robots don't care, right? And two, because care involves connectivity, empathy, listening to people in a certain way to be able to help them. And if you don't get that, and you just prescribe something, the people might not even take it, right? Because I don't know if I really need this. I don't know if they care about me. So it's that combination of someone caring about you plus the treatment that they propose, right?
I think that's very important to have that one-on-one discussion with someone who cares, and that's so important. I hope that we don't go that AI route, because that's kind of scary in my thoughts.
I think it's scary to talk about, but at the same token, Dr. Gutierrez, I just want to thank you for servicing our community and our young children. I wish there was more of you to help adults. I know that is the number one issue that we have across the United States, not just the Rio Grande Valley, but the Rio Grande Valley is facing that there's limited clinicians, psychiatrists, and mental health professions that can see you in a crisis. Because sometimes, like being bipolar, there's highs and lows, and sometimes when people are in crisis, they need to see somebody now. And if you call right now to speak to a psychiatrist, you'll probably get an appointment next year. And so as elected officials and people higher than us, we need to come up with solutions on how we're going to close that gap.
And there is some solutions, and we're starting to see them now. I've been part of the UTRGV School of Medicine psychiatry program even before it started. And we are very involved. We have 12 of our staff that are on the faculty. So we trained the residents through the 4 years, and we do it, because we don't have to do it, but we think that this is a way of helping our community eventually get more. Not all of them will stay here, right, because they're not from the valley, but we just hired our first resident that we trained, and that he's now one of our clinicians. So we think that as the years go by, and more residents start coming out of this program. And I hear that DHR and South Texas also will start in the next couple of years a residency program. So there will be more psychiatrists coming out unfortunately, none of these programs have child programs. They're all adults, so it will serve the adult population first. But I'm hoping that in the future there will be training for child too, because that's 2 more years after adults, right? So that's.
Well, Dr. Gutierrez, Mayor and I wanted to speak to a clinician and a psychiatrist like yourself to tell us the other part, because we are very excited here in the city of Mission that we have a mental health unit within our police department. And so we have officers that are trained to help the community that it's going through something whenever a phone call is being had. But with that being said, what are your feelings with that? Having local police departments help you with service.
It's been an incredible change for us. Tropical has, it's been about maybe 8 years, we've hired with the different departments that now help us, and we train them as mental health deputies. And the difference about how they respond in a mental health crisis, officers are trained to do what they need to do to secure and provide a safe environment. But once they get mental health training, and they're experts now at dealing with our population, which is different, right? And you have to be able to be more sensitive. So when they yell, you don't have to say, well, I can yell louder. It's actually, I can talk you slower or in a lower volume to engage you and help you get through this crisis. So, we have the co-responded units that the mayor was telling me that, I think Mission is doing some of that. We have it with several police departments where one of our crisis caseworkers drives to deal with the crisis, and then together they help kind of resolve it, right? Whatever, if it's going to the hospital or having them, get through the crisis to send them to outpatient treatment. And as you know, we have now the Divergent Center in Tropical, which is a 24-hour, it's not an inpatient, so if the police decide that, this person obviously has a mental health problem, and they did something that is not severe, like maybe they stole a beer, or you were yelling, or they were disrupting the public, and they realize that they have a mental health problem. Now that police officer can determine, do I take them to jail where they're not going to get any service, or do I take them to this Divergent Center? And our staff there will have 24 hours to connect them, with whatever they need. If we determine, this person really needs to be hospitalized, well, we can do that. Or if this person just needs to have an assessment to say, let's get you into services, or maybe they were our patients, they stopped coming, and they've dropped their medicines, we can connect them very soon to be able to start reinitiate their treatment again. So
amazing. Yeah. Thank you for all the work that you do. I guess my question to you would be, what message do you have to our community, our staff, in reference to mental health? I know you're very passionate about mental health, and you do such great work. Just listening to you talk here today, what's one thing that you'd like our listeners to hear from you?
Obviously there's a lot of things that can be done, but I think the first step is what we're doing now. Is if you're tuning in and you have someone that you care about, a son, a daughter, a parent, a spouse that has some needs, don't be afraid to talk with someone. Take that first step. And a lot of people will feel like, oh, I don't know where this is going to go. Are they going to prescribe medicine? Don't worry about that. That's not the most important thing. The important thing is you make that effort to connect with someone, and that already starts the healing process, right? And so we have to be better also at learning how to cope and be aware of the stress that we face in our lives, busy lives, especially professionals. We very easily can lead to burnout when we're doing so many things, trying to, do so many things in our life. And then we start not sleeping, and we don't eat healthy, we don't do exercise. We just start getting so overwhelmed with our responsibilities that we get overwhelmed, and sometimes we can lead to burnout, which can be a very serious problem that we have to face. So being aware of stressors in life and being able to manage those in appropriate ways is very important. So
I think it's important to know that mental health issues is on the upswing. Would that be correct?
Yeah. Yes. There's more and more. what I was going to say that one of the things that we've learned at Tropical, we've been open 60 years. We're getting to our 60th anniversary. And we see that our patients, especially because we treat the most severe people with the more severe mental illness, their lives are so complex. They need more integration. Like we've done primary care integration because our patients would have a lot of medical problems and they won't go because nobody really wanted to see them or they didn't feel comfortable. So now we can walk across the hallway to our clinics and they can deal with their mental health their medical problems along with their mental health issues. And we have substance use. We have a residential now in Harlingen. We have outpatient treatment. But a lot of our patients have to deal with what we call determinants of social health, transportation issues, housing, poverty, a lot of things that are not considered what people do with mental health. But if you don't address those things, and I'm talking to the choir, obviously, because governance, dealing with the population, you have to think about all those things. But those affect our patient population a lot more than anybody else. So we are trying to address those with temporary housing and other things that we're doing to help our patients with that. So it's just very complex, and I think we have to think broader than just sitting in front of someone, which is an important thing. We have to look at the big picture of mental health in our community and also that individual in that family that's coming to see us. It's kind of like using a narrow angle camera and a wide lens. You have to be switching it to think of both. And just finally, I want to do a plug-in. I was telling the mayor that we, three of us at Tropical Psychiatrist, we started a non-for-profit organization called Shrinkbox, and we do a lot of, it's a non-for-profit, and so we do a lot of blogs, educating the population about different problems. We go to schools. We do presentations for counselors for other threat assessment issues in schools and things like this. So if you want to connect to that, all of that was just an effort to connect the community. Sometimes they don't have yet the knowledge of, do I want to see someone, but I want to know more about this. And so you can connect to shrinkbox.com and you can go into the menu there and
nifty title.
Yes.
Thank you so much, Dr. Gutierrez, for taking the time to meet with the mayor and myself. This conversation is about awareness, healing, and reminding our community that seeking help is a sign of strength, not of weakness. So thank you so much. And I look forward to seeing your work and all of your students stay here in the Rio Grande Valley and help our community.
Yeah, let's hope for that.
Yes.
That's what, go out and get educated, get experience, but come back home, is what we say, right?
Yes.
So again, Dr. Gutierrez, thank you so much for being here.
Thank you for the invitation.
Thank you so much. We appreciate it, and we appreciate everything that Tropical does. Y'all have done amazing work in the last 60 years or so.
60
yeah,
years,
just a few years. So thank you so much for that. And Jessica, thank you very much.
You're welcome.
Thank you. Thank you, Mission.